Addressing a nursing shortage. Today, the top healthcare leaders in Kentucky met virtually to discuss the challenges and solutions that they're going to bring to the governor's office. WCPO 9 News reporter Jake Rouse shows some of those solutions that leaders presented to get nurses back in area hospitals.
Inside Covington's The Victorian at Riverside, 17 nurses and aides work 3 different shifts, all to help take care of the senior women here 24/7. The care hasn't changed, but CEO Carrie Vanderzee says, like many healthcare providers, help is stretched thin.
The hardest thing is if we need someone, like if we've got somebody that's on a vacation or their kid is sick and they can't come in, they've got scheduled PTO time off. If we call like a short-term staffing company to do like PRN on-call nursing, they don't have any employees.
She says some nurses have left for higher pay. Some just want out altogether.
I think COVID has had a tremendous impact because I think people have had to really work a lot more than they normally would and gotten really burnt out. And I don't know what the correction is for this.
Enter the Team Kentucky Nursing Advisory Committee.
Many nurses, after they've not been treated well, don't automatically flock to returning home.
This group is a who's who of the state's top healthcare leaders, tasked with providing solutions. As for the ideas they'll present to the governor, first, a marketing campaign geared toward recruitment.
Even a campaign that could start middle school and high school level, really drawing awareness, nursing as a profession and a career pathway.
And lowering the barriers in place to get more skilled workers back in the door.
We also need pathways for these people who are paramedics, EMTs, and LPNs to become nurses if they desire to do so.
Trying to streamline what prerequisites are required so that if there aren't enough seats in one school, somebody could seamlessly transition possibly to another nursing school.
Scholarships, financial aid, and other incentives were discussed, anything to get them back to bedside. In Covington, Jake Ryle, WCPO 9 News.
The Nursing Advisory Committee's deadline to give those recommendations to the governor is set for March 10th.